People who study the public's thinking on healthcare recently met in Washington, D.C. to discuss the results of the forums and other public opinion research.
People are deeply in a conversation, but they're early in that conversation. They are talking about things like cost, but they haven't made those trade-offs yet. They are wishing they could have something like Medicare that might just be for everybody, but nobody has said what we will give up in order to get that. They're still in that wishful stage.
I do think people are more realistic about what it may cost to expand the system. What I don't see and haven't heard, and what I think is very important, is that people aren't really grappling with the costs of healthcare other than their own personal costs. They're worried about their personal costs, they're worried about the costs of somebody who's not insured, but they're not really worried about the cost to the federal government or the state government or to their employers. Those costs are massive, and a lot of experts say they're unaffordable. I was very struck by the comment that Medicare is a godsend, because the Medicare system is in massive financial trouble. And the trustees say that to make it sustainable down in the future, you would have to raise the payroll taxes by more than 100% or cut the benefits by 50%. So these are huge, huge financial liabilities, and we're not talking about those yet in any realistic way.
It's clear that there's a mandate for Congress and the President and those of us in this country to work on this issue and to take action. But it's not clear exactly what action we ought to take, at what cost, and who will bear the burden. And so there are some realities that we need to face as we're dealing with the health care issue in 2009. It's not clear how far people will go. It's clear that they have concerns about providing health care for all children, for the elderly, for those who are forced now to go to the emergency room for primary care, for those who are uninsured or underinsured. But at what cost and who will bear the burden is not clear at all. It's not clear at all. In fact, there's a question here about whether or not people are concerned about their own good or the public good, and that question hasn't been answered yet.
And so in order for public support to be built on something stronger than sand, what questions still need to be answered? The first is funding. Since experts believe that universal access to healthcare will require more taxpayer funds, will we opt for higher taxes or cutting other government programs? If so, which ones? What might the government not be able to do if it undertakes to provide national health care? Also, if we decide that we would accept some limits on health care in order to provide universal access, where will we draw the line? To whom will we give the power to make that decision? And would we punish those who made unhealthy decisions? What if some of those decisions, like unhealthy eating habits, were motivated by poverty? Finally, once we know what kind of healthcare system we will accept, whom do we want to provide it? Do we accept the inequality of the free market in exchange for its innovations? Do we accept the government's sometimes spotty execution in exchange for universal access? Do we try some hybrid of the two, a nonprofit? On some points, better information is still needed. While insurance executives' pay or pharmaceutical ad budgets are often cited as the chief cause of skyrocketing healthcare costs, there are actually 3 other huge cost drivers that are far more difficult to resolve: our country's vast aging population, the use of expensive high-tech equipment, and the lengths to which we will go to extend the end of life. But information, while crucial, will not be enough to make one approach or another the obvious choice. The problem is not a problem that information can solve.
Not to say that more information wouldn't be helpful, but we've got a choice to make. We've got a decision. And the question that we have to answer is what ought to be. Facts can tell us a lot of things, but we have to decide what ought to be in health care. Let's take some crucial information. The cost of the various plans is absolutely essential. But even if we knew what the costs were, It wouldn't tell us whether we were willing to pay those costs or not.
We've got to get it done this year, both in the House and in the Senate. And we don't have any excuses. The stars are aligned.
A variety of policy options are working their way through our political system. But when the choice comes to us, what will we do? What will we be prepared to do? Unless we as Americans have truly come to some judgment about what we want from a healthcare system and what we are willing to accept to get it, the majority of Americans will not feel that the needed change has been made, no matter what legislation is actually passed.